Good morning, and thank you for joining us today. We're reporting 5 new cases today. Of these 5 new cases, 1 is a close contact of a confirmed case, 1 is a community-acquired case, and 3 are still under investigation. 17 of these cases are active, 4 are variants of concern, and 13 cases are non-variant of concern that are currently active in our region. We are not reporting any new deaths today. We have 3 cases that are hospitalized with COVID diagnosis, and all 3 of them are in ICU. And there's 1 active outbreak in Windsor-Essex. I'll now jump into our epi summary. So looking quickly globally where we stand, and as we can see that the cases are mainly decreasing in many of these countries, except for a few countries that are seeing a resurgence of COVID cases. Most particularly UK, that has seen a very significant increase in the number of cases and almost experiencing a 4th wave, which is predominantly the Delta variant that they're seeing. Spain and France is also reporting high number of cases. United States is also going into the trajectory of having increased cases over the last few weeks. Canada is still stable, and cases are decreasing regularly, and but there's always this reminder that it can change, as it has been changing in some of the other parts of the world too. Majority of these cases, as we reported, that are that we are seeing are result of Delta variant. With majority of the cases, almost 98% of these cases are in UK are Delta variant, and similarly, a very high proportion of cases in US, Italy, and some of the other places where we're seeing that Delta variant is the predominant strain. In Canada, overall, we are seeing anywhere between 10 to 20% of the cases contributing to due to Delta variant, and the number is increasing. And just like many of the other countries are seeing that the predominant strain eventually becomes Delta, so there is this high risk that in Canada it may happen, and we will also see Delta variant, which is a very highly transmissible strain, and could overtake the viruses, the circulating virus, and could increase the number of cases in our community. Looking at the impact on the healthcare system, what we are seeing is even though that the cases are increasing, but overall the impact on the health system is not as similar as we have seen in the previous waves, and that basically goes back to the effectiveness of the vaccine, that despite the fact that majority of these cases are happening in those who are unvaccinated, and even those who are getting the vaccine, and if they're getting sick, the severity of the disease is not as high as it used to before. So overall, the effectiveness of this vaccine and the importance of getting the 2 doses continues to be the most important predictor of what would happen if the virus continues to circulate and continue to spread in the community. So now focusing in Ontario, the cases are decreasing. We are roughly at 150 cases per day in Ontario, which is similar to what we have experienced back in September of 2020. And that number continues to go down. The vaccination effort continues to go up. Similar picture in Windsor-Essex. What we are seeing in Windsor-Essex is the cases continue to decline overall, and our current levels are lower than what we have even seen since the beginning of the pandemic. Our current 7-day average is roughly at 1.6 cases per day, and this is the lowest we have seen since the beginning of this pandemic. When we translate that into week-over-week reporting, and every completed week, our weekly case rate is 1.6 cases per 100,000 population per week, which is again one of the lowest that we have seen since the beginning of the pandemic. But looking at the past 7 days, our rate is at 2.3 cases per 100,000 population, a slight increase from what we have seen through the completed week report. And even today, when we are reporting 5 cases, again, it highlights that the virus is still circulating in our community, and we still need to take some of the precaution that we have to ensure that we keep this virus in check and continue to enjoy some of the activities. Part of this increase could be attributed to the reopening that we have seen on Friday, and showing some early signs that there may be some cases that we will see, but eventually we'd like to see those numbers down, and we want to make sure that everyone is getting the vaccine to prevent them from contracting and spreading it to others. Our weekly comparison of cases in Windsor-Essex, in Ontario, and in southwestern Ontario, a similar picture. Overall, cases are declining. Southwestern Ontario, it's stable. It's not going down, but in Windsor-Essex, we are seeing the decline, and in Ontario, we are seeing the decline. Looking at Windsor-Essex wastewater data, the wastewater data still continues to be reported at low, and minor variation and fluctuation is always something that we see, and would like to see that trend continues. Overall, it is aligning well with the number of cases. Maybe some minor fluctuations that we can see also could be reflective of some of the case increase that we have seen, 5 cases today. Hoping that it will trend down, get back to where we were before with low number of cases. Looking at the percent positivity of all the tests that were conducted in Windsor-Essex, right now with the most completed week as of July 17th, our percent positivity was 0.5%, and this is the lowest percent positivity again since the pandemic began in 2020. Percent positivity, looking at percent positivity in just the last 7 days, and in the last 7 days, our percent positivity is at 0.6%. And again, this is lower than the previous week and also below the provincial average, which is at 0.8%. With respect to percent positivity data in different age group, it's not much different in the different age bands. It is pretty consistent in all of the age bands. Overall, from a regional and cumulative regional and provincial rate perspective, we continue to have the 4th highest number of cases in Ontario. When drilling it down to further into the municipality, starting from July to present, majority of the cases that we have seen is in City of Windsor, followed by Kingsville, and then Tecumseh, and then the rest of the municipalities. Distribution of cases by municipality in the last 30 days, majority of the cases, 74% in the City of Windsor, while the rest of the municipalities have a limited number of cases. The situation is slightly different in the last 7 days. We can see that the City of Windsor contributing 70% of the cases roughly, whereas Amherstburg is the cases are showing some early signals that it's increasing 15%. But again, this data is just for the last 7 days, and it can change very quickly, especially with the low number of cases that we are seeing in the community. Looking at age and sex distribution, it's pretty much evening, leveling out with cases still predominantly seen in the younger population, 0 to 19 and 20 to 29. That's the two most important group that we are seeing, with a spike in the 50 to 59 age band as well. We're seeing no cases in the 80 plus group in the last 2 weeks, and probably due to the high, more than 90% of vaccination rate in that population group, 93% of vaccination in that 80 plus group. The sources of exposure continues to be variable, with majority of the cases coming in from the community, whereas the rest of the cases are coming from close contact and household contact, and with the occasional travel related cases are showing up. So overall, since July to present, half of the cases are coming from community spread, and the household contact and close contact contributes roughly around 25% of the cases, and 10% of the cases roughly are coming from travel related. Hospitalizations going down across the province as well as in Windsor-Essex. ICU cases are stabilizing in Windsor-Essex and continue to go in a downward trajectory in the province. Overall, day-over-day doubling time has been increasing, and again, when the day-over-day doubling time is increasing, that means it's moving in the right direction, because a higher doubling count means it is taking much longer for the virus to replicate, and we are seeing the trend continuing on in the region as well as in Canada and as in Ontario, but much more pronounced in our region. The R effective is showing some fluctuation. The most recent estimated R naught is 1.39, which is slightly higher, but because of the low number of cases as we are reporting and some adjustments, this is an unreliable data from that perspective because of low number of cases. So, and as we know that if R effective is less than 1, that means the cases are in the decline. If it's more than 1, that means that the cases are increasing in the region. But because of the low number of cases, this is not as reliable indicator as we like it to be. So switching gear from the data to the vaccine, we quick look globally. Canada is one of the leading country in the world with the most of the people who have received at least 1 dose of COVID-19 vaccine, and we continue to lead that and continue to increase that number. Looking at people who are fully vaccinated, Canada recently surpassed United States and is on track to surpass the UK in the next couple of days, and will continue on that trajectory, and it should be reflected similarly, just like we have seen in the number of people who have received at least 1 doses. So we're all looking at what's happening in Windsor-Essex residents from receiving their first dose and second dose. We are seeing that almost 80 to 90% of the vaccines are given as a second dose, and anywhere between 10 to 20% is given as first dose still. Overall, we have seen a decline in the number of 7-day average of vaccine administered to Windsor-Essex residents. We recently administered just over 3,344 doses daily to Windsor-Essex resident, and this is a huge decline from the last weeks, and we have seen a decline in the last week and from the week before, and we continue to see that the uptake is slowing down in Windsor-Essex. So putting down the picture from first dose and second dose, overall we are administering about 488 first doses a day on an average versus 2,444 second doses daily on an average. Overall cumulative dose administered to Windsor-Essex, we are seeing a sharp increase in the second dose, and now it appears that it's slowing down a little bit. So the Windsor-Essex residents that are vaccinated with at least 1 dose by age group, overall our coverage in all the age band, including those who are not even eligible, it's 65.7%, whereas the adults constitute 76.6% and the 12 plus 74.8%. We are seeing a gradient with respect to the age band, so the higher the age, the higher the coverage is. We definitely like to see the coverage with at least... We definitely like to see the coverage at least 70% or more in each of these age bands. We have lots of room for improvement between 12 to 29 age band, and we'd like to see that number increase to 70% at the minimum. From the uptake perspective, we can see the plateauing of the new doses in the older age band, but we are seeing some slight increase in some of the lower age band. There's a lot of room for improvement, especially in the 12 to 17 age band, as we are trying to prepare to go return to school in September. From a second dose perspective, the Windsor-Essex residents who are fully vaccinated, 80 plus, the vaccination rate is higher than 93%. But overall, we are seeing the same gradient effect with the lower age and lower coverage rate. And as I mentioned, we'd like to see at least 70% coverage in each of these age band to feel more comfortable with respect to the variants and the spread of COVID in our community. Similar graph like before, we are seeing the plateauing, especially in the older age band, but the number of second doses in the younger age group continues to increase, and there's still a lot of room for improvement. This is a graph that just basically shows the difference between the first doses and the second dose. Obviously, in each of these age band, we are seeing a higher coverage rate with the first dose and slightly lower in the second dose in each of these age bands. Looking at just the hotspot areas overall, as I mentioned before, our vaccine coverage rate is 65.7%. A hotspot coverage rate is almost 60%, slightly less than 60%, with the variation in each of these hotspot areas. Some hotspot areas have much lower coverage than the others, and definitely need some ongoing effort. So this is a new graph that we have put together, and it basically shows you the focus on the city of Windsor with respect to their vaccine coverage rate. The green shades are representing a higher vaccination rate in the FSAs, where the blue is slightly less than the green, and then the orange, and then purple, and then red. So all the red areas basically are showing the vaccination rates that are lowest in Windsor-Essex, and in that graph we are also have plotted the location of the mass vaccination sites in the Pentagon, so that gives you some indication of the accessibility for all these people. Pharmacies are plotted in the dotted as a dot in this picture, showing you the wide distribution of pharmacies across the region, and many of them in the hotspot areas, especially with lower vaccination rate, and followed by the pop-up clinics that we have done in the square. All the squares that you're seeing, those are the location where these pop-up clinics have already happened, and more pop-up clinics are already planned in those areas, working closely with our partners. It also shows Triangle, which is the primary care physician's office that are offering the vaccine, and this is all for the first dose coverage. Looking at the second doses, our fully vaccinated resident in the hotspot area, similar picture, say some of the same FSAs that had a lower vaccination rate for first dose, similar picture for the second dose, and highlighting the need of vaccine uptake in these areas. Similar graph, but now this time showing the fully vaccinated people, similar legends, with green being the highest and blue, followed by orange, and then purple, and then red, and also the vaccination clinic that been offered in these areas. So overall, the vaccine, we have got plenty of vaccine. We have got lots of Pfizer vaccine. We have got lots of Moderna vaccine, and despite that, the science has been very, very clear with respect to the mixing and matching of the vaccine. But with the abundance of these vaccines, we are still using the NACI guidelines with respect to to try to give the same vaccine if available. We have plenty of vaccines available for Pfizer and Moderna, so there is no reason for people not to get the vaccine at this time. Our number of vaccine doses administered by the type, we are not giving out any new AstraZeneca vaccine, and with the provincial recommendation for the second dose for an mRNA vaccine, that trend continues. But we can see that we are giving out both vaccines, Pfizer and Moderna, and we have got plenty of vaccines in our clinics, and we want to encourage everyone to please get the vaccine to make sure that we are not seeing an increase in the cases, and also are prepared for Delta variant or any other type of variant that might show up. Again, the success story of the vaccination, with the higher vaccination rate, our cases have plummeted significantly, and that is only possible if we get the vaccine. We need a very high coverage rate, almost 90% ideally, which again we may or may not get, but we will try to get to vaccinate as many people as possible. It is absolutely critical that everyone who's eligible to receive the vaccine, they should get the vaccine. We were one of the leading health units overall in the beginning with the high vaccination rate. Our community really stepped up to increase our vaccination rate. But now, as we can see, our first dose coverage rate is below the provincial average, and our numbers are slightly dropping down, while the other regions are increasing with respect to their coverage rate. So something that we need to reconsider and reevaluate and reassess. We were able to avoid the third wave because of our high vaccination rate. Other regions, they are having a much higher vaccination rate than ours, so we are at risk now to see the cases in our region. Similar picture with the fully vaccinated. We were among the leading health units with the highest number of doses. Now that number is dropping down. So we need you. We need your support to get your vaccine as quickly as possible. So in summary, our cases rate continued to decline. Today we reported 5 cases, which is again something that we need to be mindful of, and we can see some occasional spikes. And despite the fact that we are in step 3, there are much more opportunity for people to get together. There are much more opportunity to socialize with people, but in order to do that, do it safely with people who are fully vaccinated. Try to do it more in an outdoor environment. And if you're doing it in an indoor environment, make sure that you are aware and have had the opportunity to have an honest conversation about the vaccination status of everyone. COVID-19 hospitalization and ICU continues to remain low. Our first dose vaccination coverage rate is increased slightly, but not to the level where we'd like to see. Even in the second dose, it's increased slightly, but we have seen much significant increase in the past. Overall, our case rate is at 1.6, which is the lowest, but again, it can change very quickly, as we have seen from the other countries in UK, Spain, and other countries, and where some of these countries are putting those restrictions back in. We don't want that. Nobody wants that. So please get your vaccination and try to follow the public health measures. Person positivity are effective. Person positivity is good. Are effective is slightly increased, but again, it's unreliable because of the low case rates. We have one active outbreak. 76.8%, roughly 77% of Windsor-Essex residents have received at least 1 dose of the vaccine, and almost 66% of the residents are fully vaccinated. Thank you.
We'll now take questions from the media. We'll start with Blackburn.
Yes, good morning. I'm just wondering what the response has been like for registration of people who received a vaccine outside of the province.
So our response has been fairly good so far. It just took us a little bit to get our system up and running, and we will start registering those folks, but I believe we're over 1,000 and continuing to grow. So we'll have a better update in the future.
Sorry, you keep cutting out. So are those numbers reflected in our in the numbers now?
I don't believe they're yet reflected in the numbers. We're just working through the response and entering them now. So I can't say that they're all reflected, but we'll have a better update on that next week.
Okay, and I'm just...
Sorry, go ahead.
Sorry, yeah, both of them are cutting out quite a bit. I'm not sure what's going on with the microphones, but the feed keeps cutting in and out. So if I ask a question, I'm not sure if it's just my phone or if it's the feed completely. And just looking at there's plenty of vaccine supply. The number of doses has significantly gone down. What's the status of the different mass vaccination clinics? Is it time now? Can pharmacies and primary healthcare providers we take up that lead now? Is it time to make that switch, or what is your thoughts on that?
So you can let me know, Maureen, is this better? You can hear us better now?
Yes, I can hear you.
Okay, so we are getting to that critical point at this time where we have to assess the need for these mass vaccination clinic. Some of these conversations we already had with the municipalities, trying to ramp down the mass vaccination sites, and to shift some of these vaccines to our primary care providers and the pharmacy partners. It is a work in progress, and it will happen maybe in a short period, but I don't have a firm timeline to tell you, but we still have a lot of room for improvement. As I mentioned, I'd like to see our vaccination rate at least minimum in each of these age bands as 70%, and overall, obviously 80% or more. We're not there yet. So we'd like to see that number increase, and that requires still an effort from these mass vaccination sites to offer the vaccine to our residents. Once that happens, we'll be in a much better spot, but I do not anticipate that something will change that quickly. We need everyone on board. we'll share additional details about the ramp down of these clinics and also switching the vaccination back to the pharmacies and our primary care providers.
And since you announced that, all clinics are accepting walk-ins or same-day appointments, has there been a response to that?
We have seen slight uptake, but again, it will take a few days for them to register and then get the vaccine, even though when we are saying that same day's appointments are available, people may choose to book an appointment 1 or 2 days in advance. And we're hoping that that number will increase. Hold on, I'll pass it on to Nicole for further comments.
Okay, I'll just make sure you can hear me okay.
Yeah, I can hear you now.
Okay, great. So I'll just add to what Dr. Ahmed said. We are working on strategy. You've seen we've added a number of mobile clinics as well. We recognize that there's we need to get into some of these neighborhoods and work with our partners to improve accessibility. As well, we're looking at anyone who has received a first dose that has not yet made it in for their second dose, and we'll be sending reminders, calling them, and trying to get them in as early as possible. And as you've seen in our media, and Dr. Ahmed has mentioned, the walk-ins have helped. So we do see a bit of a surge with walk-ins, but we are, really just trying to continue to encourage folks to come down to our sites, especially while they're still available before they completely ramp down. And we're doing the same day appointment as well. So there's a lot of ways for individuals to get their vaccine right now. And as Dr. Ahmed said, we have an abundance of supply right now. So there's no reason, if anyone was waiting, there's really no reason to wait. So we're just encouraging everyone to get out there, whether you show up, you make a same day appointment, you show up at the pharmacy, you call your doctor. There's lots of opportunities to get your vaccine. So please do so.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Nicole. How many doses is the region sitting on right now?
I don't have the exact number.
We'll have to look at the exact number, Taylor, but I can tell you every week, roughly, we get anywhere between 16,000 to 20,000 doses. And we are giving out around to 2,300, 2,400 doses as we have, as I mentioned, daily. And this is just from the public health unit supply. Obviously, the pharmacies and the primary care providers, they have other supply as well. So we have vaccine that we are receiving every week, and we are unable to finish the vaccine or utilize all the vaccine that we are receiving. So we are having a surplus of vaccine in our region, which is, again, it's a couple of months or a couple of weeks ago, or maybe a few weeks ago, that would have been like the great news for our community. And we would be very happy that we have so much vaccine that we can give, because there was huge demand. But now we're sitting on the opposite end of it, that we have more vaccine, but very less demand. So we want to make sure that, we are getting that word out that people need to get the vaccine. What we are seeing right now is a success because of the vaccine. If we have 20-30% of people who are unvaccinated, the virus will continue to circulate in that age group and will continue to pose threat for our region. And we may have to look at what needs to be done to contain the spread of the virus. UK has seen a huge turnaround with the number of cases, mainly circulating in the unvaccinated population. Some countries in Europe are contemplating lockdown again, bringing back some of these control measures. We don't want that. Nobody wants that. And this is the opportunity. We have a head start. We can get our vaccination rate high enough that we may not have to see any of these surges. So again, I request every resident of Windsor-Essex, if they're eligible to get the vaccine, please get the vaccine.
Will any of the vaccines that we have expire soon? Is that at all a concern?
It will soon be. Right now, it's not something that we are looking, but obviously every time when we are getting these supply shipment, we look at the expiry date and we have that conversation with everyone in all the system partners that we are working with, Windsor Regional Hospital and our healthcare providers, and also with the ministry. We try to provide them with some advanced notification that we definitely don't want to waste any vaccine here. These are the precious vaccine. We are in Canada, we are privileged, we are lucky to have an abundance of these vaccine. Many countries are begging for these vaccines. We don't want to waste these vaccines. The priority obviously is our residents. The priority for this government, the provincial government and federal government, is to secure these vaccines for Canadians, for Ontarians, and for people who live in Windsor-Essex. We definitely don't want to waste these vaccines. So far, we don't have any outstanding deadline that we have to use some of these vaccines that we have right now, but we will soon be in that position if we are unable to use the vaccine that is being sent to us. So again, be a responsible person, get your vaccine, not only to protect yourself, but also look at the bigger picture. If we don't need the vaccine, we can send it back. We can send these vaccines back, and we can tell the province, we can tell the government, we don't need these vaccines. Send it to the countries who need it. But obviously the priority is our residents, our community. This is our time. This is our opportunity. Please get the vaccine.
We're seeing the phrase, the pandemic of the unvaccinated, go around a lot in news. Lots of people are saying that. Is that how you would describe what we're seeing right now in Windsor-Essex?
Generally speaking, yes. And again, our numbers are not that high every day to do a good, meaningful analysis on that. But what I can tell you still is the majority of the cases that we are seeing in Windsor-Essex is in the unvaccinated population. In Ontario, the majority of the cases that we are seeing is in the unvaccinated population. So that's definitely something that we are noticing. And again, so it's signifying two things. One is, if we have a population that is unvaccinated, the virus will continue to circulate. The second part is, if the virus continues to circulate in this population, the virus will have more opportunity to mutate and turn into something even more dangerous. We know Delta is highly transmissible, but still the vaccines, especially the mRNA vaccines, are very effective against this virus. But if the mutation happens in such a way which makes this vaccine less effective, then we may start to see more cases in the vaccinated population, more hospitalization, more people dying. So it is not only the fact that the virus will continue to stay only in the unvaccinated population, but if there are significant number of unvaccinated people, we will see the negative impact even in the vaccinated people. So as a community, it's all our responsibility to make sure that we roll up our sleeves, get the vaccine, get ourselves protected, get our families protected, and then also ensure that our community is protected.
Thank you.
Any questions from AM 800?
Dr. Ahmed, was this expected, I guess, this plateau? Did you have a gut feeling we could be at this stage right now?
Well, we know that there are different segments of the population. We know that there's lots of misinformation out there, and anyone could have predicted that maybe there will be a certain proportion of people who will not get the vaccine regardless of what you do. So that's expected, but I think we were not expecting, or I was not expecting, that this would happen right now. I was expecting anywhere more than 70-75%. We will easily get it. So now we are struggling to increase that number. So we are making very small progress when we have tons of vaccines. When we had limited vaccine, we had every appointment booked. People were looking for the appointment. So that's the struggle. I think it came in at least 10 percentage point earlier than what I would have expected, but something that we can definitely improve. As I said, overall, I want our community to have at least 80% coverage, fully vaccinated people. That's the minimum. Ideally, I would want a 90%, but at least at the minimum, 80% coverage overall for all the eligible residents, and at least 70% coverage in each of these age band to feel more comfortable and to break the chain of transmission overall in the community.
I know the promotion has been out there about the importance of getting vaccinated. I guess locally, what do we got to do here to get these individuals that are, I guess, maybe against the vaccination or like you mentioned before, I believe in a previous daily update, the individuals that got one dose, they're delaying their second dose. I guess the message to those people.
So there are a number of efforts that we are trying to do through our social media, through our print media, through our partners, to reach out to those population, and I'll pass it on to Nicole as well to add more. But basically, we are trying to engage everyone. We are trying to work with our high priority communities as well, because as we know, there are hotspot communities which have a lower vaccination rate. Engaging them, getting their vaccination rates high. So that's one thing. We're also trying to run multiple campaigns working with our school boards to have those clinics in these areas to increase the vaccination uptake for younger children, 12 to 17, as well as their families. So trying to target both in these areas where we can see. We are working with many of the other partners from a translation perspective, an engagement perspective. Our team is coming up with more targeted communication strategies to address that. I'll pass it on to Nicole to maybe add more to what we are doing.
So I think Dr. Ahmed covered it really well, but you raised a good point about individuals. There are, I don't have the exact count, but there are quite a number of individuals in our community that have received their first dose and not yet their second. We don't have all of the reasons why individuals are waiting. Some might have been waiting for a certain vaccine. Our message is that, we have an ample supply of vaccines of both Moderna, Pfizer. There's no reason if you're waiting to go get your vaccine. As well, we're hearing things like people don't have time or, they're not sure if it's needed. And so it's upon us. We're trying every avenue to get that information out there to show people that it is needed. Fully vaccinated means 2 doses plus 2 weeks, and it does matter. As well, as far as time, we have mobile events, we're taking walk-ins, we have pharmacies that are taking walk-ins. So, time people have to make time and they have to make the effort, and we'll do whatever we can to make it easy for them to get them in for that second dose so they're fully vaccinated. As well, Dr. Ahmed said, we're working with our partners, with our school boards, with our community, and I think as residents, sharing information, talking to your family, talking to your friends. It is about protecting yourself, but it's also about protecting our community and each other. And I think the more we can have that conversation and have that discussion, the better we'll all be.
Thank you.
Any questions from CTV?
Yes, good morning. So obviously you touched on plateauing and everything a lot. I just want to know specifically, is there a percentage point where you think we will reach herd immunity? Is that the 80% or what?
So the science table had put out their modeling, and with the highly transmissible Delta strain, they would like to see a vaccination coverage rate of 90%. So we can say that that's the target for the herd immunity that they have set it up. We'd like to get there. That's why I say that's the ideal situation that we'd like to see. We have high vaccination coverage rate for other vaccines. This is a pandemic. This virus has caused a pandemic, deadly pandemic. Millions of people have died in this world. The economy has been severely disrupted. So I think it just sometimes it's hard to understand why people think that this is not a disease that is worth taking action against and getting the vaccine. We have obviously set up a minimum target of 80% for our region, but we'd like to see that going all the way up to 90%. And if people need information, people need education, please talk to the people. We are here, your healthcare providers are here, and there is a general consensus among all the healthcare providers for the importance of the vaccine. There is no scientific data, there is nothing that would say that you should not get the vaccine. Everyone needs the vaccine, and there are very, very limited or almost no contraindication to get the vaccine. You should get the vaccine. So if you have any doubt, please get to the right information, read the right information, talk to your healthcare provider, get the information that you need, and get the vaccine. We need that 90% to fully feel that we are safe and protected. And we're not there yet, and we won't be there in the near future, but we definitely don't want to see a fourth wave. We definitely don't want to see a lockdown. And if people, as residents, if we want to avoid that, we need to do our part and get the vaccine.
Okay, thank you. Now I know over the past week or so we've been seeing conflicting reports regarding masking for kids in schools. I know the CDC is saying that there's no need for them. Your thoughts or where are we at this point?
So we, again, we have never said in our region that the mask is mandated by the health unit for the school-age children for a number of reasons, because these are little children we are talking about, and the potential risk and benefit of them wearing the masks or not. But from a health safety perspective, masking, yes, it makes sense, and if anyone who is able to wear the mask, they should wear the mask. That's our recommendation for anyone who is indoor. The Ministry of Education obviously will come up with the criteria and the very clear guidelines that what is the expectation starting September for different age groups. And even some of the lessons that we have learned from Israel, which has achieved the highest vaccination rate right from the beginning. They have seen many outbreaks in their school-age population, because that's the population that is not vaccinated anywhere. Children who are under the age of 12, they are not vaccinated. So yes, the likelihood of them getting infected and passing it on to others is less. But if you have a significant number of unvaccinated population, which is like 20%, even when we are saying 80%, you have 20% of adults that are unvaccinated. 20% of our adults in our region roughly translate to almost 50,000 adults in our region. So 50,000 adults in our region, and if you even take half of them, 25,000 people or 25,000 families, they are unvaccinated, and if they're sending their children to school, you can imagine how many children could be potentially coming in infected and passing it on to others. So there is that risk, and in order to mitigate that risk, we have to take a very structured approach in how are we mitigating some of these risks by something that we can do from a system perspective or engineering control perspective, but also from a human behavior perspective. When we're talking about the human behavior perspective, we have to look at the evidence against the masking and also the recommendations about masking. The science table has basically recommended that the mask should stay for the school-age children, and until we get to a place where we no longer need it. Canada has done remarkably well with respect to the COVID cases compared to many other countries. And we have done that based on some of these scientific advice, some of these scientific guidance that will continue to state and continue to support masking at this time.
Okay, great. And just one last quick question. The Ontario Science Table came out with their thoughts for vaccine certificate. Your thoughts again?
I will defer that question probably for the next time. I haven't seen that report, so my apologies. I try to stay on top of everything, but unfortunately this is something that I haven't seen, so I'll have to take a look at it before I can comment.
Okay, thank you.
Any questions from CBC?
Yes, good morning. I think all my questions have sort of been asked and answered already, but Dr. Ahmed, is it frustrating for you to see that we have so much vaccine right now and, like you said, so much room for improvement in the vaccination rate?
Of course, as I said, that when I'm looking around the world, because it is important that we learn lessons from other countries, we have seen that there are countries that are struggling. They don't have the resources or the availability of the vaccine. People are dying there. Thousands and thousands of people are dying every day. And it is unfortunate that the people who need the vaccine, they don't have the vaccine. people who have the vaccine, they don't want the vaccine. So it's almost a very ethical dilemma that we are facing right now is, yes, we want to save these vaccines for the people, for our region, for residents of our region, while on the other hand, there are people who are dying and need these vaccines badly. How do we find that balance? How do we ask this question even to ourselves, that I have the access, but I don't want that, and I also don't want it to give it to someone else? So I think those are some of the ethical dilemma that we are struggling with. Our priority is our residents. We want to make sure that everyone has the opportunity. Once that opportunity is no one picks it up, I think we'll have to ask this question that should we be even having these vaccines here when people are dying in other parts of the world?
Any questions from CFTV?
Yeah, just a quick one, Dr. Ahmed. I was wondering how the vaccine coverage is with our migrant worker population. Are they coming out and getting those vaccines and being protected?
So we have done very specific targeted campaign to target the temporary foreign workers, and our vaccination coverage rate in that population group is anywhere between 60 to 70% to my estimation. It's hard to give you an exact number because the population come and go, but our focus and our target has always been there. We communicate with the employer. We work with our partners in the Leamington-Kingsville area to offer vaccination for them. So we are doing our work to engage them to get the vaccine. But roughly I can say our coverage rate would be anywhere between 60 and 70%.
And switching gears a little bit here, you're talking about the Delta variant, and you were talking about schools and children not being masked, and some being masked and some not being masked. If this Delta variant really takes over, how safe is it going to be to let our kids go into school? I mean, it's, you take a look at it, and even if your child is vaccinated, they can carry it on them and pass that virus off to someone that's not vaccinated. If these children are not vaccinated, does that not present a huge problem to the population as a whole in the schools, within the school system?
So that's a good point. And so let me just clarify one comment of yours, and the scientific data that is emerging. And again, because science evolves all the time, the emerging data is basically suggesting that if you are vaccinated, the likelihood of you passing it on to others is low. So if a child is vaccinated, the likelihood of them passing it on to someone else would be very low, and them getting sick would be very low. For those who are unvaccinated, if they get sick, they can pass it on to other children who are unvaccinated and can potentially expose those who are vaccinated as well. So overall, if that happens, that poses a risk to the classroom. And when we are talking about the importance of education, especially in-person education in the classroom, this is absolutely critical that we do our best to keep our schools open, to keep our children in the school system. And if we have a large number of children who are unvaccinated, that would be a problem. It would lead to school closures. It would lead to suspension of classes, disruption of classes, which is not something that we want. So as a parent, I think it is my duty to make sure that my children, if they're eligible, they are vaccinated. And I do my part, and we get everyone vaccinated. Like even my friends, like if my child is playing with other children who are at the same age band, and if I have got my child vaccinated, I should be talking to them as well to make sure that they are vaccinated as well. It needs an entire community effort. Obviously, in the absence of a mandatory vaccination policy from any levels of the government, it has to be something that as a community we have to address. And as a parent, obviously, I will address it with my child and with the friends, my child who they're friends who they're together. But this is something that we all need to do. I don't know, Nicole. Yeah, okay. I'll pass it on to Nicole to add.
I'll just add to what Dr. Ahmed said is, I think part of your question is around going into the school year and those children that won't be eligible for vaccination yet. And again, we'll be working with our school boards as we did last year, and it's I think we've always said that we recognize the importance of children being in school for their healthy development, their mental health, and their learning. And so it's vaccination for those that are eligible for vaccination. That's critically important. And then also continuing to ensure that public health measures are adhered to and in place. So things like masking, which you've mentioned, are things that we'll be looking at and supporting our schools in, distancing, maintaining physical distance, and doing all the great things that schools did last year to continue to protect children in their classrooms so that they can learn and continue to go to school. So those will just be the other pieces going into the fall that will be important, and we'll be working over the summer diligently with our school board and with the recommendations coming from the Ministry of Education to support children to be in school, and they can do so safely as long as all those public health recommendations are adhered to.
I can't hear you very well. Your speaker just went out.
Oh, can you hear me? It looks like it's on.
I can hear you just barely.
Oh,
Is that better?
A little, you're still cutting in and out.
yeah.
It might be the speaker.
Something's happening with your speaker.
No, it's fine. Can you hear me?
I can now.
Okay. I'm not sure how much you heard or didn't hear, but basically I just mentioned that above and beyond what Dr. Ahmed said, your question related to children who might be unvaccinated in their younger years who are not eligible when they start to school. It's the continued adherence to our public health measures. So distancing certainly is something we've always recommended and will continue to do so, especially when you're looking at indoors, and the question of masking and other measures and engineering controls will be things that we'll be working with the school board to ensure that it's safe for children to return to learn.
Wonderful. Thank you very much. No further questions.
Any additional questions from Blackburn?
The button's off.
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
No, thank you. Have a good weekend.
Thanks. Any additional questions from CTV?
No, thank you. Have a good weekend.
Any additional questions from CBC?
No, thank you.
Any additional questions from CFTV?
No, thank you. Have a great weekend.
Thanks, everyone. Take
Have a
care.
great weekend, everyone.